Welcome back. I'm an emergency doctor actively working at the emergency department of my hospital. In this Doctor's Corner series, we'll dive into lesser known approaches and hidden strategies to help the people with critical illnesses. You can subscribe if you want to learn the latest news and healthy solutions about your life. Today, let's talk about knee joint pain, and let's focus on something that sounds simple but can be medically powerful when it is done correctly: aerobic exercise. If your knee hurts, your first instinct may be to rest it completely. That makes sense. Pain is your body's alarm system. But ask yourself this: if the knee is painful because the joint has become stiff, weak, inflamed, overloaded, or poorly conditioned, what happens when you stop moving it for weeks or months? Often, the muscles around the knee get weaker. The joint becomes stiffer. Balance gets worse. Body weight may increase. Walking becomes more difficult. Then the knee feels even more painful during normal daily movement. So the deeper question is not, should I move or should I rest? The better question is, what kind of movement gives the knee the right dose of stress without overwhelming it? That is where aerobic exercise comes in. Aerobic exercise means rhythmic movement that raises your heart rate and breathing for a sustained period. Think walking, cycling, swimming, water exercise, elliptical training, or low-impact dancing. For knee pain, especially knee osteoarthritis, major medical guidelines consistently support exercise as a first-line treatment. Not because it magically rebuilds a damaged joint, and not because it cures every cause of pain, but because it improves the environment in which the knee has to function. Look at the knee as a living system. It is not just bone rubbing on bone. It includes cartilage, ligaments, tendons, the joint lining, fluid inside the joint, nerves, blood vessels, and the muscles of the thigh, hip, and calf. Pain can come from many parts of this system. Aerobic exercise helps because it influences several of these parts at once. Start with stiffness. Many people with knee arthritis say, "Doctor, the first few steps are terrible, then I loosen up." Why does that happen? Joints like motion. Cartilage does not have the same direct blood supply that many tissues have. It depends partly on movement and compression to help circulate joint fluid and nutrients. Gentle repeated motion helps lubricate the joint and can reduce that stuck feeling. Do this carefully. Begin with slow movement before asking the knee to work harder. Now look at muscle support. Even though aerobic exercise is not the same as strength training, many low-impact aerobic activities still activate the quadriceps, hamstrings, glute muscles, and calf muscles. These muscles help guide the knee. When they are deconditioned, more load is transferred directly to painful structures. When they are more capable, the knee often feels more stable. How does this help? Better muscle endurance can reduce the feeling that the knee is giving out, and it can make stairs, shopping, and walking across a parking lot less threatening. Pay attention to body weight and metabolic health. Every step sends force through the knee. The force can be several times body weight, depending on speed, slope, and gait. If someone loses even a modest amount of weight through a combination of nutrition and activity, the knee may experience less repeated load over the day. But there is more. Fat tissue is not just stored energy. It also produces inflammatory signals. Aerobic exercise can improve insulin sensitivity, blood pressure, cardiovascular fitness, and systemic inflammation. Why does that matter for knee pain? Because joints exist inside the whole body. A healthier internal environment can make pain easier to manage, even if the joint still has structural changes. Now think about the nervous system. Pain is not only a message from the knee, it is also processed by the spinal cord and brain. When pain lasts for a long time, the nervous system can become more sensitive. Aerobic exercise can help activate the body's natural pain-modulating systems. It can also improve sleep and mood, and those two factors strongly affect pain intensity. Ask yourself, when you sleep badly for several nights, does pain feel louder? For many people, yes. So improving sleep quality and stress regulation is not separate from knee care, it is part of knee care. But here is the important part: the dose matters. Too little movement may not help. Too much, too soon may flare the knee. So don't use the all or nothing approach. Use a graded approach. Start with what your knee can tolerate today. If you have been inactive, begin with 5 to 10 minutes of easy walking, stationary cycling, or water walking. Do this 3 to 5 days per week. Keep the intensity at a level where you can talk in full sentences. This is sometimes called the talk test. You should be breathing more than at rest, but not gasping. If walking hurts, do not immediately conclude that exercise is impossible. Change the surface. Walk on flat ground instead of hills. Shorten your stride. Slow down. Try a stationary bike with low resistance. Try water exercise where buoyancy reduces joint load. Try an elliptical if it feels smoother than pavement. The best aerobic exercise for knee pain is the one you can repeat without a major flare. Use the 24-hour rule. During exercise, mild discomfort can happen, especially if the joint is stiff, but pain should not sharply escalate. After exercise, symptoms should settle back toward your baseline within about a day. If your knee is much more swollen, more painful, or more unstable the next day, reduce the time, speed, resistance, or impact. Do not punish the knee. Train it. Warm up before you judge your pain. Spend 5 minutes moving gently. If you are walking, start slower than your normal pace. If you are cycling, start with very low resistance. If you are in the pool, begin with slow marching or easy laps. Why? A cold, stiff joint may complain early, then improve once fluid movement, muscle temperature, and circulation increase. Progress slowly. Add time before intensity. For example, if 10 minutes feels acceptable for 1 week, go to 12 or 15 minutes. Once you reach 20 to 30 minutes, then consider making the pace a little more challenging. Do not add hills, speed, and duration all at once. Change one variable at a time. Aim, over time, for about 150 minutes per week of moderate aerobic activity if your health allows it. That could be 30 minutes, 5 days per week. But if 30 minutes sounds impossible, break it into smaller sessions. 10 minutes in the morning, 10 minutes after lunch, and 10 minutes in the evening still counts. The knee does not need a heroic workout. It needs repeated, manageable practice. Now, let's be practical about different aerobic options. Walking is accessible and useful. Choose supportive shoes. Look at your route. Flat, predictable surfaces are usually better than uneven sidewalks or steep trails. Keep your steps smooth. If your pain is worse on downhills, avoid them at first. If you limp, slow down or shorten the session. Limping can irritate the hip, back, and opposite knee. Cycling is often knee-friendly because it is low impact. Adjust the seat so your knee is slightly bent at the bottom of the pedal stroke, not deeply compressed. Start with low resistance. If the front of the knee hurts, check the seat height and avoid heavy resistance. Do not turn cycling into a grinding strength test. Swimming and water aerobics can be excellent when walking is painful. The water supports part of your body weight while still giving resistance. Pay attention to stroke choice. Some people with knee pain dislike breaststroke kicking because it can twist the knee. If that bothers you, choose flutter kicking, water walking, or pool-based movement instead. The elliptical can work well for some people because it reduces impact, but if the machine forces your knee into an uncomfortable path, choose another option. Your body's feedback matters. Now combine aerobic exercise with smart joint protection. Avoid sudden increases in jumping, sprinting, deep squatting, or repeated kneeling if these trigger symptoms. Use handrails on stairs during flares. Consider a cane in the opposite hand if walking is painful. That can reduce load through the knee. Ask a physical therapist to assess your gait, hip strength, foot mechanics, and movement pattern if pain persists. And please, do not ignore red flags. Seek urgent medical evaluation if knee pain follows a significant fall or injury, if you cannot bear weight, if the knee is very swollen after trauma, if it is hot and red with fever, if there is sudden severe pain, if the calf is swollen or painful, if you have chest pain or shortness of breath, or if the knee locks and cannot straighten. Also get checked if pain is persistent, worsening, waking you repeatedly at night, or associated with unexplained weight loss. If you have rheumatoid arthritis, gout, lupus, advanced diabetes, heart disease, severe lung disease, balance problems, or kidney disease, get personalized advice before increasing activity. If you are pregnant, returning after surgery, taking blood thinners, using insulin or medicines that can cause low blood sugar, or taking blood pressure medicines that affect exercise tolerance, ask your clinician how to exercise safely. If you use anti-inflammatory medicines or painkillers, do not use them simply to hide pain and push through damage. Pain relief should help you move wisely, not recklessly. A common mistake is waiting for pain to disappear before moving. For many chronic knee conditions, that day may not come first. Movement is often part of how the pain improves. But another mistake is forcing painful movement because someone said, "Exercise is good. Be more precise." The right exercise at the right dose, repeated over time, is what helps. Ask yourself these questions before each session. What is my pain level before I start? Is there swelling? Did my last session improve me, irritate me, or do nothing? Can I talk while exercising? Am I limping? How does the knee feel tonight and tomorrow morning? These answers guide your plan better than motivation alone. Look at aerobic exercise as a long-term prescription. The medicine is movement. The dose is time and intensity. The side effects can include temporary soreness if you increase too fast. The adjustment is to reduce and rebuild. The goal is not to prove toughness. The goal is to restore trust in the knee. If you are starting today, do this. Choose one low-impact activity. Set a timer for 10 minutes. Warm up gently. Keep the effort moderate. Stop if pain becomes sharp, if you feel unstable, or if swelling increases. Repeat it several times this week. Then build slowly. Add strengthening and flexibility later, because the best knee programs often include more than one type of exercise. But let aerobic movement be the foundation that improves circulation, endurance, confidence, and whole body health. Knee pain can make your world smaller. Aerobic exercise, done carefully, can help make it bigger again. Start small, pay attention, progress gradually, and involve a professional when the symptoms are severe, persistent, or unclear. Take care of your knees, take care of your whole body, and keep moving with wisdom. I'll see you in the next topic.